Hello, everyone. It's long since we tackled obstetrics and gynecology. Now, today we are going to check on that. We're going to focus on benign and malignant conditions of the vulva. Now, during your introduction into reproductive health, you did a lot on anatomy of the reproductive organs, okay, or reproductive system. You did handle some things to do with the vulva as part of vagina or the reproductive organ in a female. So we had external reproductive organs and internal, which internal included the uterus, the oviduct, the ovary, the cervix, and all those ones. You even discuss the parts of the uterus from the fundus, isthmus. Okay, so then the vulva was just the external reproductive organ comprising of the vagina, the urethra part, the labia majora, and the labia minora. Now, today we're going to check on the benign and malignant conditions of vulva. Okay. So remember, vulva, just the vagina, because that's got an inner lining, which is always a benign, epithelial, just a epithelial membrane, okay? Smooth epithelial membrane, maybe a bit of squamous in nature. But then we want to check condition, which are the benign malignant condition of the vulva. Now, benign, just more of a cancer, but a polite cancer. Malignant cancer and benign cancer. These are tumor. Tumor is just develop overgrowth of tissue, which are cancerous. So when they are benign, they are defined into some characteristic which are bit tolerant, unlike malignant. Malignant is stubbornly overgrowth of tissues and cells, irregular, cannot even be traced to the parental cells. They overly increase in size and they metastasize completely fast. But benign, they are every polite, and actually the baseline, even prognosis is somehow, yeah, recommendable. So benign epithelial disorders of the vulva include several inflammatory, ulcerative, and blistering disorders, as well as pigmentary changes which involve the vulvar region. Okay. Now, to those who are in position to watch our YouTube videos after these sessions, you are lucky because you can read. Reading is the best way of understanding. Okay. So we have said they can present with inflammation, ulcerativeness, blistering disorders, so as well as pigmentary changes involving the vulvar region. As I've told you, vulva just the vaginal region. Now, inflammatory disease involved the vulvar region include the following. We have the lichen sclerosus, okay? We have squamous cell hyperplasia, the CH, yeah, with or without a type here. Then you have the lichen simplex chronicus, primary recurrent dermatitis, intertrigo, allergic contact dermatitis, fixed drug eruption, atopic dermatitis, seborrheic dermatitis, psoriasis, Reiter disease, lichen planus, lupus erythematosus, diarrhea disease, apoptosis and Behcet disease, pyoderma gangrenosum, Crohn disease, hidradenitis suppurativa, Phosphodisa disease, plasma cell vulvitis, vulvar vestibulitis. All those ones are diseases, okay? They involve inflammation of the valve. Now we have the blistering diseases which involve the vulvar region, but they only form blisters. These are just like familial benign chronic pemphigus, or what we call the Halley disease, bullous pemphigoid. We have the cicatricial pemphigoid. We have the pemphigus vulgaris. We have the erythema multiforme, epidermolysis bullosa. Remember, erythema multiforme is also one of the very emergency skin condition in any person, in any part of the body, not necessarily the vulvar region. Then we have pigmentary changes. Now, this is just the pigment, the color pigment, the vulva is what now. This condition associated with those color changes in the vulva. So the big pigmentary changes, okay? So we have the acanthosis nigricans, lentigo, melanocytic nevus, post-inflammatory hyperpigmentation, post-inflammatory hypopigmentation, vitiligo, vulvar melanosis. So most of these conditions not necessarily that they have to be only affecting the vulva. Some can affect, like vitiligo can affect anywhere of your body. Realize some people have got patches of, I mean, they are black, but again you can see they are sort of like burn or albinism Then the mix of white and black, they have white patches as if their skins are turning to be white. Okay, so that's called vitiligo. Vitiligo. Okay, it's more of liver enzyme condition. Somehow melanocytes have got issues in this case, but then they can spread up to the vulva. Similarly to the melanocyte nevus, lentigo, lentiginosis, they can spread up to the vulva. So that is the one. Those are conditions, pigmentary changes. Okay. Away from that, we have benign tumors or hematomas or cysts involve the vulvar region. They include the mucus cyst, the Bartholin and the skin duct cyst. These ones you know, common. Bartholin and skin duct is very common. Okay. Epidermal inclusion cyst, you also know that. Seborrheic keratosis, acrocodon, fibroma, fibromyoma, dermatofibroma, lipoma, hydradenomas. You see, syringioma, hemangioma, lymphangioma, angiokeratoma, pyogenic granuloma, endometriosis, pterotropic sebaceous gland, and sebaceous gland hyperplasia. Still have schwannoma, angiomyxoma. So there are very many, okay? And then the ones that you can be born with, congenital malformation that is involved in the vulvar region. So these are like the ambiguous external genitalia. Some have them very big. Somebody is born with a very big external genitalia, okay? Congenital labia hypertrophy, you're born with big labia majora, okay? Labial adhesions also, these are now intact labia, you're born with the intact labia, okay? Or it can be born with atrophy of the vulva, may also occur. So let's start with the first, what we call VIN. You've heard of this condition, VIN, called the vulvar intraepithelial neoplasia. Neoplasia is just new cell growing. Intraepithelial is within the epithelium, then the valves, so there are new cell growing in the vulvary epithelial, okay? So the vulvar intraepithelial neoplasm or the VIN is a precancerous skin condition of the vulva, and it occurs when there are changes in the cells of the skin covering the vulva. So, VIN or the vulvar intraepithelial neoplasia is not cancer. However, if the changes become more severe, cancer of the vulva may develop after many years. Okay, so when you diagnose this, your diagnosis is done even 5 years ago. You should follow up and make sure that the management completely eradicated the VIN. Because if you just wait and waste time, you'll end up having cancer. Okay. So it's also known as dysplasia or VIN and can range from mild to severe. So exact causes, the cause is not known. However, it has been linked to many things like HPV, as you know, human papilloma virus, common infection, simplex virus, granuloma inguinale, sexual transmitted disease, smoking, people who are immunosuppressed, chronic valve irritation. So all these ones can cause that. So if you have chronic valve irritation, to mean you keep on scratching your external genitalia and you're a female, you have itchy, maybe it's because of scabies or your hygiene issues or maybe STI, ATI, that's called chronic valve irritation. Immunosuppression, maybe people who are non-communicable diseases and they are not managed well, people who have HIV and AIDS, people who are definitely smoking, also the immune are also compromised. Smoke brings in a lot of things, okay? So that is also attributing to that. Now, clinical symptoms of VIN, of vulvar intraepithelial neoplasia, they are varying, but they can say chronic vulvar itching, that's one of them. Burning, tingling, or soreness in the vulva area, change in appearance in the affected area, including the areas of redness or white, discolored skin, slightly red skin lesions, some may appear darkened like a mole or freckle, pain during sex. In rare cases, there may be no symptoms initially. So diagnosis may include one, a physical exams, what we call the colposcopy. Colposcopy. Remember colposcopy, yeah? An office procedure that uses a special microscope called colposcope to closely examine the tissue for abnormal areas. So a biopsy of the affected areas also. A local anesthetic is given to numb the area, and then a small sample of the vulvar tissue is then taken, and then cells are examined under a microscope. Lifestyle habits that may help prevent VIN or detect it early include practicing safe sex, vaccinating girls with HPV vaccine before the first sexual contact, regular exams for early detection and treatment, preventing cancer of the vulva from developing as well. So that is that. So treatment varies depending on how abnormal the skin cells are, the size of the affected area also, and the estimated risk of the area developing into vulvar cancer. So the treatment option can be steroid creams to reduce inflammation and to control symptoms such as itching. Okay, yeah, surgery to remove the abnormal tissue that is at the end result. Laser therapy to destroy targeted areas of normal cells using a beam of light. We have the diathermy, which uses a tiny electrical current to cut out the affected areas. Topical chemotherapy cream to remove abnormal cells, and vulvoectomy, remove the whole vulva. In rare cases where the affected areas are very large, VIN can recur after treatment. Therefore, regular follow-up appointments are highly recommended. Okay. Apart from the VIN, we have MVL, the malignant vulvar lesion. Okay, malignant vulvar lesion. So these are most common etiology of vulvar cancer. But it involves infection with the human papilloma virus, the HPV. So in this group of women, there is an association with the high risk sexual activity, like those who are selling their organs outside the sickle circle ladies, the prostitute. I mean, then there is also association with increased rates of tobacco use, and in the younger age, okay, then the remaining cases are seen mostly in elderly patients and does not have an apparent association to HPV infection. So it's not preceded by vulvar dysplasia and is commonly found adjacent to chronic dystrophic or inflammatory lesion. There are also a small portion of vulvar cancer classified as melanoma, sarcoma, or basal cell lesion. So let's check on the epidemiology. Vulvar cancer accounts for approximately 5% of all female genital malignancy. It occurs in about 2.5 per 100,000 women years in developed countries, but is 2 to 3 times more frequent in underdeveloped countries. So, with the exception of the rare sarcomas, these cancers appear most frequently in women aged 65 to 75 years. And in some series, almost all the patients are aged 70 years or older. So, vulvar cancer, this one can appear in younger patients, of course, and in some large cancer referral institutions are very important. So approximately like 15% of all vulvar cancer occurs in women younger than 40 years. And these young patients tend to have early microcarcinomas, which may be associated with things like diffuse epithelial neoplasm of the vulva, the one I've just talked about. So prevention that although there is no screening for vulvar neoplasia or vulvar cancer, immunization with the quadrivalent or nine-valent HPV vaccine, okay, and smoking cessation has been shown to decrease the rates of disease. So we have melanoma. Melanoma is the second most common invasive cancer occurring in the vulva, but its occurrence is very rare. Melanoma probably arises from the lesion containing a junction or compound nevus, considered pigmented lesion of the vulva, suspicious if they are blue-black in color. So they have a jagged or fuzzy border and a raised or serrated, and they are also larger than approximately 1 centimeter. So melanomas may be misdiagnosed as in differentiated squamous carcinoma, particularly if they are melanotic. Okay? So most melanomas are located on the labia minora or clitoris, and the prognosis is related to the size of the lesion and the depth of the inversion. So approximately 3% of the melanomas are located in the genital tract. Now, melanoma of the vulva accounts for 5 to 7% of the invasive vulvar cancers and has an estimated annual incident rate of 1 per 1 million women. So the disease can affect women of all ages, but is more common in the older population. So with almost half of the patients aged 70 years or older, more than 90% of melanomas occurs in white women. Okay, let's check about Paget disease. Paget disease, we've talked about this for so long. So Paget disease of the vulva is rare. So it occurs in women, okay, and in seventh decade of life. Seventh decade is just 70 years and above, but can occur in young patients. Okay, so symptoms of pruritus, that is that reaction, itchiness or inflammation, which causes the skin to burn in itch. Okay, symptoms of pruritus and tenderness or identification of vulvar lesion occur most frequently. So the patient may experience symptoms for several years because seeking medical advice. The lesion may be localized to one labia or involve the entire vulvar epithelium. So it may extend to the perirectal area, buttocks and inguinal area, or mons. It has been observed extending into the vagina as well. Okay, so vulvar lesions usually are hyperemic and they may be demarcated sharply and thickened with a foci or excoriation and induration. The vulvar skin may be thick, leading to the impression of leukoplakia with a cake icing effect. Okay, so this classic finding almost is the pathognomic for Paget disease. The lesion is usually superficial and is considered an intraepithelial lesion. Although underlying adenocarcinoma may be associated with Paget disease, older literature suggests that underlying adenocarcinoma occurs in about a quarter of cases, but more recent data find less association of Paget disease with the underlying adenocarcinoma. So that's very important, okay? So on the next one, we'll continue on benign and malignant conditions of the cervix. So that is all about the malignant, benign and malignant conditions of the vulva. You can watch and then you do the exams.